Welcome to Startup Health Now. This is the podcast where we celebrate the most innovative entrepreneurs in health and the moonshots they're working to achieve. I'm Nicole Clark, Startup Health Senior Writer. Today, I'm pleased to be talking with Kevin Dedner, founder and CEO of Henry Health. Kevin's on a mission to increase the life expectancy of Black men by 10 years within the next 25 years. At Henry Health, he's created a digital community of licensed therapists that can provide culturally sensitive teletherapy to Black men and their families. In the last month, he's expanded his platform in a variety of ways. As you might expect, there's been an increase in the need for mental health and wellness services as a result of the pandemic, especially digitally based ones, and especially culturally relevant ones that serve some of the hardest hit communities. Henry Health has stepped up to the plate to help. But even before COVID-19 hit, Kevin was actively at work writing the next chapter of Henry Health. Kevin, it's great to have you on the show. I appreciate you joining me today.
Oh, thank you, Nicole. Thank you for having me. It's fun to be here.
So we have a kind of semi-regular rhythm of catching up over an interview like this a couple of times each year since I first met you a couple years ago in DC at 1776. So, but it's been a minute since we last spoke, and you know, the world is a tad more different these days. How are you doing personally?
Well, you know what? First of all, thank you for asking that, Nicole. I think it was, it reminds me of this story when I first started Henry Health. I went knee deep into, talking to investors and trying to attract, the talent that I needed, and I probably went about 5 months before anyone asked me, how am I doing? So, for you to remind me of that, I really appreciate that. And it makes me want to reach out to that one fellow who, before we started talking, he asked me to take a break and tell him how I was doing. I am surviving really well. Very grateful. The pandemic has not come very close to my family. I have had one very distant cousin to pass away, but not in my immediate family. And my children are safe, and I'm safe. I did make the mistake of just plunging deep into work when the pandemic first hit. And I wrote about that publicly, about what a mistake that was, because I think all of us deserve to take a step back and think about the adjustments that we need to make to survive in this new space. And I think, the first response that society gave us was to all push forward very aggressively. Kids went to learning remotely instantly, and everyone went to, working over Zoom instantly. And I actually think that was a really bad mistake. And I suspect that is starting to play out now, that we're a couple of weeks in, that people realize that they're working themselves at a rate that they probably shouldn't work. So all of that being said, thank you for asking me how I am doing. I really appreciate you doing that.
Yeah, it is a weighted question these days. And, I think it's important to ask it with the intent of having a couple minutes to really talk about how the person's doing, how we're doing. And I hear you on that jump straight. And, it would be easy to throw ourselves into work. It has been easy to do that. It can be a distraction, right, away from the crisis. But in essence, in part, what we're doing is almost not acknowledging some of the trauma that comes with something like a pandemic. And, I think distracting ourselves away from ways that we can connect still. And on that note, my second question is, given that we are hardwired for that connection, this time of isolation is really requiring that we get creative in how we create community. What are some of the ways you've been able to stay connected during this time of isolation?
Yeah, well, it's interesting. I've already sort of been meeting virtually and talking with friends virtually. But, to tell you just a funny side-by story, I had a grandmother who turned 103 years old last month, and we had a virtual birthday party for her, and it was an amazing thing to see, like all of my family, including my 103 grandmother, in this virtual birthday party. So yeah, I think like everyone else, I've sort of really been leaning in, taking advantage of the technology we have. I live in Washington D.C., and in our neighborhood on Fridays at 7 o'clock we have a dance party where we play loud music in the streets and everybody comes out and dance in front of their house. So these have been like really small things, but they really have kept me very connected, and obviously I'm very connected to my team. It seems like we're working much more these days than we've worked in the past.
Well, a belated happy birthday to your grandmother. That sounds lovely.
Good. Thank you.
So unpacking your health moonshot a little bit, going to shift gears here to talking about Henry Health and your work there, and learning about how you've expanded your mission. So starting with the former, your moonshot to increase the life expectancy of Black men by 10 years. Black men have the lowest life expectancy of any major demographic group in the U.S. What role does Henry Health's platform play in longevity for Black men, and more broadly in offering culturally relevant care?
Well, first of all, thank you for the question, Nicole. And I think, you're in a very unique position because, you've been around the company and following the company, even following how we talk about ourselves since the inception of the company. And I just, I want to be honest, we started here pointing out literally a 100-year-old problem of Black men having the lowest life expectancy of any population. And we know that the data tells us that, this low life expectancy, there's a direct correlation between unmanaged stress and untreated mental health issues. Stress is, a real trigger to these chronic diseases that cause premature death. And so, we are very proud to have this founding that, we're bold enough to take on this problem that has really been in the forefront, been a problem rather for the last 100 years, and no one has been bold enough to take on it. So I'm proud that we've done that. But it's interesting because as we've talked about the need for culturally competent teletherapy, what has become clear over the last year and a half for an early stage startup like us is that there is a real need for culturally competent teletherapy. The mental health system in itself needs to put culture first, and we talk a lot about culture first at Henry Health. And that has been lacking in the mental health system. And so, as we have been out talking with investors, obviously there's also been tension with investors thinking that our market was too niche. And so, we've struggled there. And part of the reason that we struggled is, we wanted to keep our integrity in our conversations with Black men. They've said to us very clearly that every time something has been created for us, we ultimately lose it. We don't have a sacred place. We don't have a space to, address our needs and issues. And so, that has been a tension for our company, candidly, since our founding. And it's funny, when we were together in January, we started to talk about men and their families having this, sort of much broader vision that we couldn't support men if we didn't support their families. And, although we've been talking about community in our model, I think just within the last 2 months, the concept of community has crystallized a lot more. And the crystallization of community has also helped us to see Henry Health different. And so, where we are today, is that we see Henry Health as a culturally intentional behavioral health provider, creating digital communities for populations to meet their specific need. And our first community is created for Black men, and that community is going to be called Men Thrive. And in fact, I've not even talked about this publicly. This will be the first space that I talk about this publicly, is that so Men Thrive will be powered by Henry Health. And, you think of it sort of like there's this parent, which is the culturally intentional behavior health providers, Henry Health, and we intend to birth communities that, that people can find identity in.
Tracking the evolution of your company has been fascinating, and I think just the timing, as you said, in the last couple of months, as you guys have kind of continued in that organic change. The phrase "for such a time as this" comes to mind. That the platform that you've been building has, in some ways, added relevancy right now during the pandemic. So before talking about how you've been able to address some care gaps specifically to the pandemic, do you mind giving kind of a walkthrough of somebody that might come to henry-health.com and explore some of your mental health and wellness services? What are some of those buckets of services that you're currently offering within this initial community of Thrive?
So right now, our very core offering is web-based therapy. And so, also an app is available. We're using a third-party platform to offer that therapy right now. And we've been really focusing on building out our self-care version of our app. And so we expect that self-care version of the app to be available at the top of the summer, which, obviously is the Men Thrive. And there you'll see in the self-care community, like all of the core things that you see provided, like in what I'm going to frame this as mental wellness apps. So that would be like meditations, daily motivational messaging. We'll also have some video content. Our chief community officer for Men Thrive is Jeff Johnson. Jeff is going to be he has a podcast that'll be a part of the community. So, we anticipate that we're going to have this very, very dynamic community experience that people will have in the early version of the app. But, the core offering right now is the teletherapy. And as we've been testing, as I think and I'm not sure all the listeners will know, so I mentioned this, we train our therapists in a research-based technique that was developed by an academic at Johns Hopkins that helps our therapists with cultural humility. And so, we've been really testing that model out by providing therapy these early years. We've also really been pushing out a lot of self-care articles. We're providing wellness calls right now for free. And meaning people can actually request a call from a therapist in the midst of COVID-19 to check on them and sort of give them tips on how to adjust. I think, Nicole, I talked a little bit earlier about all of us taking a step back and realizing what's going on. I think that there's probably a lot of anxiety that people are experiencing, and it might be, anxiety. Some people may be experiencing this for the first time and not have the types of tools in their tool bucket to deal with anxiety. And so, we want to make sure that we're available to provide that type of support to people. And, the evolution of the community concept kind of puts us in a really unique place because, what we're saying very boldly to people is that our services are really for everyone, and that, we're going to build communities for everyone ultimately.
Yeah, and as far as some of the services that I've seen, just kind of by way of following you on LinkedIn and social, that Henry Health has been offering are some of these webinars related to mental health and wellness topics. There's also, I think, the wellness check-ins that you're offering. Can you talk a little bit about how you guys have pivoted to offer some of these services during the pandemic?
Yeah, it's interesting. So when the pandemic first hit, and this is the piece I mentioned, I wrote about it, the first week after it became clear that life was not as it was, we put together a webinar series, and we just wrapped up the first webinar series last week. And these webinars have been free and open to the public. I think there were a total of 5 webinars, and those webinars are going to be, or they should be available, even they may already be up on our website that people can go back and view those webinars. But what we wanted to do was to make sure that we helped people adjust. Our audience, Nicole, has not been traditionally exposed to therapy. And so it's interesting. We've seen these webinars as a way to start to get people in relationship with us to start accessing therapy. Another thing that we've done in the midst of COVID-19, like we significantly reduced the cost of therapy on our platform. Like there's not a better deal, candidly, in the country right now in terms of paying for therapy than what we offer if you're paying out of pocket. And if you live in DC, Maryland, and Virginia, we also have agreements in place with major payers, so you may not even have to pay. So yeah, it's a, I think all of the mental health companies are reporting an increase in services and demand. We've seen that too. And we're trying to make sure that we improve that user journey, that we can get people into therapy much quicker.
So to kind of summarize there, the webinars that you've been offering throughout the pandemic, those recordings are going to be available on your website, and then for anybody that would be interested in kind of the standard community and culturally sensitive care that you're offering, that can also be accessed. People can sign up for that from your website as well?
Yes, absolutely.
Okay. So for this last part of our conversation, kind of turning the focus to the future, if you will, by studying the present. As you mentioned, this pandemic, it became very clear, early in the year, that this pandemic was changing the course of history. And to that end, I think it's important to start the conversation now about where we want to end up. In particular, having a conversation about the role that racism plays in this pandemic and overall in health and wellness. So to put this next part of that conversation in context, I wanted to reference an article from mid-April in The Atlantic. It was written by Ibram X. Kendi, the director of the Anti-Racist Research and Policy Center at American University. He wrote a powerful essay highlighting data that was gathered by his research center and the Atlantic's COVID tracking project. And in this essay, he essentially confirmed what we know, that the disparities between the size of the Black population and the percentage of Black people infected with, hospitalized with, or who have passed away from COVID-19, those disparities appear to be the most severe in the Black community. And in his essay, Kendi asks what he calls the question of the hour. Why are Black people generally being infected and dying at higher rates than other racial groups? Backing a little bit up from that, Kevin, when you and I first met, you introduced me to the theory of John Henryism, a theory backed by the research of Sherman James, whose thesis was that when resilient people work hard within a system that's not afforded them with the same opportunities as others, their physical health deteriorates. So my question is, how does John Henryism and some of those underlying philosophies of Henry Health, how does that impact the racial disparities we're seeing in the pandemic and in the pandemic response?
Yeah, wow. Well, it's funny because I've not talked about this publicly, but I've been very silently frustrated about this because I think, when we see this disproportionate death, and particularly, Nicole, I'll go a step further. The data is also showing that Black men are severely impacted here. It goes, but just back to the core of why we even started Henry Health. What is true is prolonged stress breaks down your immune system, and makes you more susceptible to disease. And so what we see a lot in these COVID-19 deaths is that people have pre-existing conditions, diabetes, hypertension, et cetera, that has weakened their immune system and make them more susceptible to COVID-19. So, for me, it's been, I've sort of been very silently frustrated because I think, what I am convinced of is that if we can help people manage their stress and their anxiety differently, that they will have different health outcomes. And so, I think if someone hasn't done their homework, when we talk about like stress and anxiety connected to COVID-19 deaths, that would seem like a stretch, but it's really not a stretch. It is, what the major question here is like, what has caused these immune systems to be so weakened that they're more susceptible to disease, to death in COVID-19.
Are there are there any kind of overarching insights or words of encouragement, maybe from the Henry House therapists and counselors, that can be shared to help those that feel like their narrative is either underreported or improperly addressed during COVID-19?
Yeah, I think, and this is the beauty of us training our therapists in this evidence-based technique that helps them with their cultural responsiveness and humility. And as I mentioned earlier, one of the things that we've been saying internally a lot lately is culture first. And our therapists are trained to examine culture first. And so the good news about where we are right now, if there's any sort of good, like a way to examine and look at this in a good way, and that is, that you and I are having this discussion. We're saying, why is it that this is the case? And it puts, this sort of the John Henryism sort of discussion back on the table, like what is happening over time when people work harder, they're more stressed out, like what happens to their immune system. And I think, the good news here is that I think that, on the post-pandemic world, and we're already starting to see some of this, is that we're going to see some real policy solutions, that we're going to be rethinking, how we live. And I think that that's going to be important because I also think that there's going to be like a legacy of pandemic, even in the mental health space. I'm sorry to say that, we'll have like a whole new set of issues, people dealing with anxiety, people dealing with, this sort of transition of trying to get back into work after having been out of work. And then, obviously 30 million people have lost their jobs. And, so, just even the stress and strain of that uncertainty about their future is, I think that we have really not even begun to understand that impact. But, I think that our therapists, what I have been so pleased with is that like my personal experience is like was always honored. And I'm actually speaking of like Tony, our chief clinical officer now, but I know that that's how he has trained our therapists to interact with clients, that, their personal experience is honored. And so I think for people who are seeking care, it's really important that people honor the experience that they're having right now and, speak to the exact narrative of what's happening in their lives.
I think it's an interesting point, like you said, of just, some of the potentially positive fallout that we might see as far as policy changes, and even colloquially as a more normalized adoption of mental health practices, kind of coming out of the shadows of talking about the fact that we see therapists. Are there, I think personally, I find myself more comfortable talking with my parents who didn't come from a generation of seeking mental health, of talking to them about it. And, that's one type of positive change, I guess, that is been instigated by this pandemic. Are there other changes like that, or things that you hope will stick as far as thinking about that post-pandemic world?
Yeah, I think there are a lot of changes that are going to come out of this. I think, for me personally, I mentioned, this Zoom family reunion that I had a couple months ago. I think that families are becoming more connected than ever before. Um, you know, I think all of us have sort of been so busy that we didn't, make the time to stop and check on each other. No one ever, there were plenty of cell phones around my grandmother who's 103 years old, but I probably only saw her twice a year, and that was in person, although there were phones around her that had video features, right? So I think, like there's this normalizing of like how we interact differently. And also not just it's a very sincere interaction because we truly want to see how each other are doing. And I think on the other side of that, Nicole, is, we should be revisiting how we work. Maybe the 5-day work week shouldn't be anymore. And maybe, children shouldn't go to school exactly 5 days. Maybe they have a day and a half at home or so. And maybe the work week looks a little bit different. So I think I think if we handle this period right, that it's an opportunity for us to re-examine life totally. And I've been watching these like reopen committees that states are starting to put together. And I'll tell you, I've been really disappointed. I haven't heard people talk about like, reimagining what work looks like as we reopen our economies, because I think that, um, the thesis of our founding is around unmanaged stress and untreated stress for Black men. But what we know is that is an American problem, that we're all overstressed and overworked. And so I think that, this is a great opportunity for us to like rethink those things that are stressing us out and bring our lives out of balance.
Well, every time I have a conversation with you, I certainly leave rethinking a lot of things, and this conversation is no different. I really appreciate you joining me today, Kevin, and for taking the time.
Oh, I'm glad to be here, and I appreciate the opportunity to visit with you because you helped me collect my thoughts in a way that is very helpful to me. So thank you for that. A good interview is also good for the person who's like wrestling with these issues every day, because you help me organize my thoughts much better. So I'm grateful for that, Nicole.
I call it thinking with my mouth.
Thank you for that.
Well, you can learn more about Henry Health at henry-health.com. And I encourage you to follow them also on LinkedIn and their social media. You do a great job, Kevin, of putting out resources and information that's easily accessible and relevant. So thanks for joining us. Tune in next time here on Startup Health Now, our podcast about the health transformers who are achieving health moonshots.